So please, everybody, we are now welcoming 3 fathers to our group. This is Joseph Murray,
better known as Ella's dad.
Andrew Tavani, and DebRA's own Brett Copeland.
Hello. I think we have to move these closer to us.
Thank you very much. They are going to be speaking about insurance, and they welcome your questions. So let's get started. Thank you.
Who starts off on this?
Well, first, I want to bring everyone up here. You guys are too far away.
Yeah, definitely come a little closer if you don't mind.
I know we're conference fatigued and we're towards the end, so we're going to try and shake it up a little bit. So everyone in the front row.
That's right. Sit on the floor, whatever.
Crisscross applesauce.
Mostly because there's not a mic being passed, and we want to make this a little bit more interactive than what's happened in the past throughout this conference. So it'll be easier for us to understand the questions. Yeah. Who's starting this off?
All right. So my name is Andrew Tavani. I live in Atlanta, Georgia. And I have a daughter named Ellie Tavani. And she's 8 years old. And if she's in here, raise her hand. My girl. And she's an RDEB. And like many other people in the room, we'd never heard of EB when she was born. And when the challenges started. And I know firsthand the emotional, the financial pain and angst that all of you are going through, because I'm going through it and I'm living it. And all the research, and by the way, Brett, your team has done a wonderful job bringing in tremendous speakers. All the research that's going on and all the programs are fantastic. We have, until a treatment and a cure is found, we have to fight every day to make sure that our kids and our families have the resources so we can function in normal everyday life. And as you are for your kids, and I want to speak for Brett, actually I will speak for Brett and Joe, because I know that they're the biggest advocates for their kids, just as you, and you have to continue to do so. And it's kind of, you have to roll up your sleeves and fight, and sometimes it's tiring to fight. But you have to be the best advocate, whether it be insurance, whether it be an aid in the school system, and there's a lot of different aspects. And what we're here to kind of tell everybody is just what our experiences are. We don't know every law in every state, and we don't know every experience out there, but what we do know is kind of what we've gone through, and we want to try, we could even spurn a few ideas and a few thoughts to help you get more resources for your children. That's kind of the goal here. Yeah. And I don't know if you guys want to add anything to that, just on the introduction side.
Well, I could, just walking around and seeing everybody, it's very clear that people have already won a lot of their own advocating fights. I mean, clearly, like for me, it took over a year to get a motorized wheelchair for Rafi. And I see a lot of motorized wheelchairs, so either you got the best insurance on the face of the earth or you're very good at this. So the things that we've gone through are not necessarily the things that you have. But what we kind of want to put forward is, it's not the size of the dog in the fight. It's the size of the fight in the dog. And sometimes that fight goes on for a long period of time. And these are things that have worked for us. And we'd like to share some of those experiences with you.
And my name's Joe Murray. The greatest kid in America to me is my daughter Ella Murray, who's 7 years old. And like all of you believe your own kid is and know that they're the greatest kids in America. It's great to be here. It's great to be on this with these group of fathers here and to get to know many of you from this time who've traveled here, at expense and time away from jobs and family. And thanks, DebRA, for putting this all together. I guess the to start out, the most important thing that I've learned in advocating for whatever Ella needs, whether it's an aid in school, like Andrew said, or increasing our DME coverage cap through our employer insurance, applying for Virginia. We're in the DC area, we live in Virginia, but Virginia Medicaid is, my experience has shown it's all these battles and efforts are more of an art and less of a science. And the art is not pretty. It's basically, I like to call, Andrew and I talk a lot about, block, tackle, and run, like doing the simple things of, reading the letters that you're getting, or taking the first and last name of the person you're talking to on the phone at the insurance company, writing good notes. My wife, Katie, will confirm that we have binders of just random notes that I've kept from the day Ella was born. And all of that comes back to help whenever you're talking with an insurance company or her school or anything. The dullest pencil is better than the sharpest mind in a lot of this stuff, and when it comes to record keeping. And that's in addition to being an advocate, that's one of the biggest things that we've found that's been helpful for Ella and for what we need for her.
So we thought we would break it up into 3 different areas. We would talk about insurance, and how we've each had a fight with insurance. And in my case, we had the bone marrow transplant paid for, and I was able to get that done in 3 days. From the time I mailed the letter to the time they called, to winning the fight with the wheelchair, even being denied twice, and how I had to eventually threaten to sue. But the way that I went about it was not necessarily emotional, but by fact, which goes to Joe's point of being the great note-taker. Because you drown them in facts. You got to think like a lawyer, which Joe is, and drown them in facts that they can't say no to, and it doesn't matter. So we're going to talk about insurance. We're going to talk about the Medicaid system, whether it be the insurance being either public or private, and how, I think we're all in some way on the public dole. Rafi is a Medicaid provider. We get our nursing paid for, 16 hours a day. How we've beat the school boards as well, and local government in some case. So is there an area you sort of want us to start off on, whether it be Board of Ed or insurance or government? School? Okay. You want?
Yeah, so I think all of us have an aide that go to school with our kids, and that is paid for, either by the state or by the school system. And my experience in Atlanta, Georgia, is most of these school boards and county school board systems and governments haven't heard of EB. A lot of them have dealt with it very infrequently, if at all. A lot of the doctors that make these decisions, on the school board, don't really know what EB is. So what we've really had to do is you have a mountain of paperwork that you're going to have to fill out, and how you fill out that paperwork is extremely important. So it's not just, you have to have the details and the facts behind it. And first it starts with going, I know this seems very basic, but first it starts with going to your doctor. Because, the doctor is not going to vouch for this diagnosis if you don't go and see your doctor. So on a regular basis, you need to go see your doctor and make sure that the nurse or the doctor actually record good notes instead of saying doing well or doing okay. I mean, that's a relative term, but it's extremely important that those notes are taken, because what's going to happen is you're going to need to send in those notes. And part of the decision being made if you're going to qualify for an aid or for insurance or what it be is going to be based on those notes. And I know that seems really, really basic, but I know before that I wouldn't know what notes the doctors were taking on myself or even my child. And I think first that's extremely important. I think on the school side also, no one, even though we all deal with some significant challenges, none of us are entitled, to anything, and surely the government doesn't feel that way. So it's very important to try to know, what the law is in those states and what kids with disabilities are actually under the law, what services that they need to provide. I think that's extremely important. Every school system is going to have different budgets and a different sort of protocol, but I think if you have those ducks in a row, that is very beneficial. And then, you kind of go through the EB. There's a couple things on the school system. There's a 504 plan and there's an IEP. So one is basically has to do with learning, and the other one has to do with the health, of learning. Just kind of looking at my notes. And Ellie has doesn't have an IEP, but she does have a 504 plan. And it basically, when we drop her off to school in the morning, the nurse, we drop her off in the carpool line, the nurse gets her out of the car. When we pick her up, the nurse is actually putting her in the car. And, in between there, there's holding hands, up and down, just basic things, holding hands up and down the stairs, and certain things in PE that she's not able to do. Make sure that within the school that the temperature is right, so they're not getting too hot. In Georgia, the summer, the beginning of school year, in the end, it's extremely hot. And make sure that the temperature is at the right level. That she's not in harm's way when kids her age are running around where she can get run over. Because obviously, these kids are extremely fragile. And then we're very open with the parents. Because a lot of them haven't seen this, to try and write a letter. I know each year we actually would write a letter to the parents, letting them know what Ellie has. It's not contagious, and that she's a kid like anyone else and likes to do some of the things. And if they have any questions, they kind of contact us. But I think if you're able to do those things, one, you're able to kind of keep your resource once you're able to fight and get it, but also you're able to get, the community, the school system, and the administration to kind of buy into what, to what you're trying to do to get that aid. And once you have it, there's no guarantee that you have it for life, so you have to keep fighting to try and keep it.
So for me, with the Board of Ed, we live in New York City. Rafi is almost 7. The classroom settings are incredibly crowded. They're not temperature controlled. The lunchroom settings are chaotic at best. And what I would say about this is sculpt your argument before you start to have it. And then you build an outline and you start filling things in. So in our case, we knew that the public school system in New York City was not going to be able to keep Rafi safe, therefore not educate her well. There's a federal law that says if they cannot educate, that they have to pay for a specialized school. Now, granted, this was generally created for autism and other cognitive disabilities, but in our case, because they couldn't keep her physically safe, and with temperature control, with hallway control, that we sued the Board of Ed to have them pay for a mainstream private school. So we have to do it every year. But the arguments were tough because the New York Board of Ed says this is a mainstream school. We are not going to pay for that. And in New York City, it's $37,000 a year for second grade. So literally every year it's a fight. It's every year it's sculpting an argument of why they can't keep her safe. That the school we're going to is able to provide the OT, PT, they work with us, they allow the nurse in, and eventually we beat them down, so they pay about 90 to 95% of the tuition. It takes a while. It's frustrating, but in the end, like I said, you got to build your case because you'll win. Especially with something like this. That is, you're not looking, it's not an ADH issue, which is hard to quantify. This is a very quantifiable issue in that case. So it is doctor's letters. We have an IEP. We didn't have to go the 504 route. But like I said, Rafi goes to private school, thank you to the Board of Ed of New York City, for this year. And then next year we'll have to fight again. And the year after that, we'll have to fight again.
We've been very fortunate and blessed that Ella she has an IEP. She's a rising second grader, and through kindergarten, first grade, she's had a full-time aide provided through her IEP. And the best approach that we've taken. And I think in this regard, it was better to be lucky than good, is what I like to call like clerk law, which is basically get to know the person who is not necessarily making the ultimate decision on whether your child's going to be approved or denied for, in this case, an full-time aide. But the administrators that greet our daughter every day at the door, who are the gateway and basically the gatekeepers to those decision makers. Like who is the person that's accepting the paperwork, and just be nice and just be thorough. And we found that if there's a benefit they'll give you the benefit of the doubt that if you don't dot your I's and cross your T's correct, if you've had a relationship or at least a polite rapport, that goes so far. Because as Andrew said and Brett has indicated, the complexity of a lot of state laws, federal laws, and then local school board laws, is a full-time job for any parent, nonetheless any person who actually can read 20 to 50-page documents, which is just really taxing, giving all that parents have to deal with full-time jobs and whatnot. So again, getting to know the folks that are going to be helping those decision makers, we found, has been incredibly useful. And thankfully, we haven't had an issue with our IEP. We've had one, but it's working out right now. So
The only thing I want to also add is mentally and emotionally be prepared to get denied. I mean, it's not you. Lots of times this is not going to happen on the first go round. So, I mean, even though you're going to be miffed and saying how can my kid realistically get denied? I mean, what you have to go is you have to get beyond that and find out, now what is the next step to challenge that? How can you appeal that, and where can you go and take your case? So a lot of people just drop it at that point, and at that point, that's when you really have to roll up your sleeves and start to fight. Kind of what Brett says, that you need to have the fight in the dog.
Yeah.
I mean that's
the fight in the dog.
Right there is where it starts. And that's where it's going to start on the insurance side, the school system side. But on the school system, a lot of schools, I know where we are, they don't even have a full-time nurse. They will share nurses between schools if someone's, diabetic or something like that. But there are funds there in order to get a one-on-one nurse if your kid, needs it. You just are going to have to fight for it. And I think lots of times is I'm always a big believer to, even though I may not know them, you need to find people who have had similar instances so you can find how they went about it. And for us, in some sort of regard, we've all gone about it and are happy to help at least give you our experience that may help you in your experience to try and get either an aid approved or, expanding the DME for the insurance or what have you. But I think that is extremely important. And I know it's tough because you're trying to get through every day. I mean, you're just trying to pay the bills. You're trying to just get through a taxing day of doing bandages. But your kid going to school is extremely important, and the safety of sending your kid off knowing that they're okay is significant. But you have to be prepared to fight.
Let's see if they have questions. Do you guys want to ask us any specific questions about how we sort of, Patrice?
Patrice.
Well, I think I'm friends with all of you or your wives on Facebook, so you probably know our story. But Jonas mentioned to start kindergarten in the fall, and basically, like after the ADA talk the other day, like I'm like, all right, I'm ready to fight now. I kind of just stopped because there was not, like we were saying, emotionally and mentally prepared to do
Sure, I have no problem giving that to you.
So, I'll give you my email address after, y'all wouldn't mind doing that.
Yeah, we have, in our school, we have PT and OT coming in. We've got a full-time nurse that is, I wouldn't say integrated into the classroom, but is there for Rafi. During gym time is when PT/OT happens. So we can give you very specific.
Part of the issue, you know, not just junctional, so he can navigate his environment a little bit better, you know, that sort of thing. He doesn't have the scarring. But they're basically saying, well, we can't qualify him on the potential of something that might happen. I'm like, well, do you want me to like shove his face into the car?
They said the same thing to us.
Yeah.
They said the same thing to us, Patrice.
Yeah, we'll be happy to send you our 504 plan. I mean, and you can pull out of it kind of, you know, we usually, you can pull out of it what you like and what you don't like, but I think some of the things in there may be helpful of what the challenges are.
Have you met with these folks in person? Like, have they met Jonah?
Well, just, yeah, the same team twice.
Okay.
Twice. And
Right.
had the letters from the doctor and all that.
Board of Ed did the same thing to us. So the school that we were zoned for said to us, we can't keep her safe. It's impossible for us to do it. The Board of Ed said, we can keep her safe. You know, and at that point, and it was the same thing, we had to put the money up. By the way, the Board of Ed, you can sue for legal fees. You can get the legal fees back. But, you know, in this kind of way, it's good to have the attorneys because they know who to argue with. They know the people that are arguing on the Board of Ed side, right? And they should be able to, on, you know, the initial discussion, really give you the idea of your chances. But so there's another family in New York City with a boy that's Rafi's age, also goes to a private school, and the same lawyers said that they probably would not be able to get it paid for, but we were able to. So, and it's the same lawyers. So it is an uphill battle, but it's one that can absolutely be won. And this is, we can help get some of the physicians that are nationally recognized within this to do that.
Jay?
Maybe off-basic, but assuming that there's not some privacy issues that would need to be dealt with, is some of this information stuff that we could actually put, you know, in a secure place on the website where you have to sign in, we have access to it, but things
No.
like some of these IEPs
No,
and
no. You'd have to redact a lot of information. We don't have that kind of unfortunate, it's a very nice idea, but because it is state, local, county, I mean, not yet. But we'd like to create some boilerplates of letters. I mean, take the insurance stuff, right? How many times have we said, we read the medical director from Aetna, you know, has denied your claim, you know, for I'm a moron reason, right? So I actually took a different approach than Joe does. My first one was, okay, you know, I understand why you know, denied us for a wheelchair, right? I'll have the letter of medical necessity revised, you know, to say it's for use in the home, not for out of the home. Redid it, expedited appeal. It came back denied. So that just annoyed me to such a degree that I looked up what the 7 criteria were to get a wheelchair. And in that letter of medical necessity, there was justification for each of the criteria, for all 7. You only had to meet like 6 out of the 7 or 5 out of the 7, but there was one for each one. So I actually said the medical director was incompetent, didn't know how to read English, you know, because, you know, their basis for denial was, you know, completely and utterly wrong based on page 1, line 32. And here's the direct quote. And I quoted the letter of medical necessity, quoted their reasoning for denying, and said, look, what is clear here is that she is capable of getting this and needs this. You are denying her, not for medical reasons, but you're being prejudicial, and you don't want to say it, so I'll have no other choice but to pursue legal remedies at this point. And lo and behold, 48 hours later, I got a call saying, yes, you have the chair. But wasn't nice.
Well, a couple things that we'd have done
Yeah, that's extremely effective. I think also, you know, having your doctor or other teachers help be an advocate for you as well. I think sometimes when the parent is definitely, you have to be your child's best advocate, but it always helps if you have a champion.
Yeah.
Absolutely. And I thought Brett's example was a great,
Yeah.
triggered a thought in mine about, you know, sometimes you have to actually do the job of the person who should be doing the job. And
Yeah.
pointing them to their own documentation and making the case. And yeah, not being nice sometimes, you know,
Sometimes.
being sweet.
It was the
You know,
second
just
time.
making sure that, you know, hey, you know, this is what your manual says, and this seems very inconsistent, and, you know, fix it, so.
Right. But you have to have the facts to win the
Yeah,
case.
you can't be just emotion.
Right. Yeah. I mean, like you can be annoyed, and I'll say my letter was snarky, but I had absolute proof that they could not say no, and that's the argument you have to make, no matter where you're going for, whether it's enrolling in a Medicaid case, finding out what programs are available to you, and that's sometimes digging.
And that picture example, like you said, that picture example, I think, you know, the human side really becomes much more real. Like, and asking Patrice if they've met Jonah, like our school had never, you know, educated an EB child, and we met with them in person just to have a pre-meeting to the real meeting, and we showed up, and like the school principal, assistant vice principal, and like 8 other people were there. And as soon as after the meeting, you could tell it was very clear. They were like, you know, we don't know if she's, you know, IEP or 504 or whatever. Like, we're just going to make this work because I think, frankly, they were a little bit scared of having her there, which worked to our advantage. And they just kind of made it happen because they did, you know, and that's, the human side is critical.
I think I think DebRA. I think we used it. The CD, the school CD.
Oh yeah, we did that too.
I think that is also something. I'm sure Brett can send along a copy.
Oh yeah, we posted online.
But now it's online. But I think that is huge to send along to the administrators, and because a lot of them just aren't going to be educated on it, and that right away is you know going to give you a head start to try and get stuff approved, just along that CD.
And we'll write as the national organization, we'll write a letter. You know, we will help you fight as much as we can, because, like they said, let's take Medicaid for a second. It's different. It's a federally funded, but it's also state funded. It's also county funded. So it's different in everything. So we just don't have what they call bandwidth to actually fight the fight for you. But we'll write the letter that says, here's the reality of this disorder, and here's why. You know, you need to either pay for the wheelchair, approve the nursing, pay for the special school. We have no problem writing that letter. I mean, that's what we're here for. So,
Any more questions on the school system? It may be a good time to pivot to insurance. If no one has
we got
any
a
more
question
questions.
over there.
Sorry.
Instead of writing the letter, who do we contact for you to write the letter? You just email at the DebRA?
You can email me, and it's Brett, BRETT, at debra.org.
Okay, perfect, thank you.
You saw a question in the back, in the pink, and then you, sir. Yeah, go ahead. Please, yes.
Right. So is there, I didn't hear, did you get a question?
Can you ask that one more time? I'm so sorry.
Oh dear.
Thank you.
I'm echoing in myself. Okay, just wanted to reinforce what that lady said concerning pictures that she had to send. My doctor, primary care doctor, Dr. Adams, is a wonderful advocate for me. And me and my nurse went to see the doctor about something, I don't know what, but she mentioned that she had taken some pictures of some of the worst wounds on my body, and he perked up with that and asked to have her send him some pictures because he was having a hard time trying to justify my need for as many bandages as I want. And sometimes you can have people that are willing to help you, but you've got to give them the ammunition to help you also.
Yeah.
That it?
Excellent point.
Other school questions?
Mine's related again to the 504 versus the IEP. And I guess more my question on that was, I know you're saying you can't give copies of letters or things that you've done because it would be too difficult to go through all the redacting information to share it. But
I said I couldn't post it online.
okay.
I said I couldn't post it online behind a login sort of site.
Okay.
You know, if you need sort of something along those lines, I'm sure one of us would have no problem in doing a cut and paste to create a boilerplate kind of document for you.
Okay. Yeah, more what I was looking for was some kind of bullet points, things that maybe we could take things, that apply to us and drop things that don't apply to us as we go through this process with our son.
Yeah.
Definitely.
Happy.
Yeah, I mean, like the informal information network, I mean, this is a great example of this conference of just the relationships you're making and finding out what's worked for us. Like, we'd be happy to talk with you and offline and share whatever's worked, in addition to whatever DebRA can share.
If no one has any more questions on the school system, let's want to pivot to insurance.
Sure.
Obviously the day-to-day, the bandages. I know some people, they're obviously, extremely expensive. I mean, I know ours range, anywhere from $5,000 to $7,000 or $8,000 a month, or what the cost would be. Some of you are more, some of you are less, but it's, regardless, extremely expensive. Depending upon your insurance or your Medicaid, it's going to vary as far as what they're going to cover and what the needs are, but that's kind of the lifeline for our children. Even more important than going to the doctor, as important as that is, it actually getting the bandages. And lots of times, most people don't have that sort of money laying around to be able to pay for that. There's different options. I mean, obviously, with Obamacare, we're all entitled to get insurance, but what's actually covered is a different animal. And as Brett used a great example of getting a wheelchair, lots of plans will have limits as far as how much they'll cover. I know with the company that I'm after, that I work for, I've had a challenge every year because they had a limit on durable medical supply, durable medical equipment, and that's how they book bandages, and we've had to get a waiver. And I think what I would do is you need an advocate not only at the insurance company, but I think the biggest advocate that we've seen is actually the distributors are actually fighting on your behalf. The National Rehabs, the CCSs, the Sterling Medicals, whoever your supplier is, those people are, for us, we use National Rehab, but they've been fantastic for us to actually help us fight to try and get a waiver so that the bandages can be booked under major medical.
Which means no cap.
And I think that's extremely important, and a lot of people don't know that's accessible. But I think that's extremely important that you need to be able to do that. A lot of you may or may not be on Medicaid. Every state's going to be different as far as what they cover. Some are very good. I know Virginia and New York are fantastic as far as their Medicaid. Georgia Medicaid, where we are, is not good as far as covering bandages. They cover $25 a month, but it still is good as a secondary insurance. But you still have to, for us, it was still very important to actually fight. In our experience, we actually had to win a lawsuit against the state of Georgia that LE qualifies for a level of care, it's a battle every year. It's not that different from the school system, but I think you need as many advocates as possible. But I think the one thing right off the bat is, have your distributors fight for you.
Yeah. So the other thing is know your contract. So for the bone marrow transplant, right? Rafi was the 8th kid to undergo the bone marrow transplant at University of Minnesota. And, if you look at a contract, verse 1, sentence 1 is, we do not pay for experimental treatments, right? And they had this term that says, in our sole judgment, whether they would pay for it. So everywhere it said, in our sole judgment, except in one place on page 152, and it just said, in our judgment, not in our sole judgment. So I had them beat right off the bat. I knew it, because another Blue Cross Blue Shield had paid for the bone marrow transplant. So it's no longer in their sole judgment, it's in the judgment of Blue Cross Blue Shield. But I didn't even have to go that direction, because like this, I put a 25-page paper together, used Joe David Fine's numbers. We all know that Wagner was very open with his results, so used those as well, and got it approved in 3 days. But I had them beat, because this is all about building the argument still. So thankfully, in that case, I didn't have to go for it.
We had an experience where we changed jobs, and I see Katie changed jobs, and she was working for a big employer of 500 employees, where they had a DME cap of $10,000. And the long and the short of it was, they were a self-insured company, so they could determine pretty much whatever they wanted to cover. And it came down to us asking her boss and the CEO to make the call to waive that. So that's just one example of, if you're with a big employer that is self-insured, that they have their discretion to make those changes. And, we're thankful that happened.
Just also another thought, even we got partially covered. We were able to have a, I'm sorry.
I have a private insurance. I have United Healthcare, which I consider to be the, as my children would put it, the morons of the insurance company. They like to not pay for very much at all. And so they've not covered my bandaging supplies. I've ended up having to buy my own little cart to be able to get around when I've needed it. I have junctional EB. And I've not been very successful in getting them to pay for anything with EB. And my doctor hasn't been, I don't know, probably some time ago she used to be a fighter, but not as much anymore. And I'm having a hard time getting everything that I need. I can't even get the silver cream. I would like to be able to get that approved with my insurance company. We are an ERISA plan. They have dropped me before because I have another disorder that does cost about $7,000 a month. They don't pay that, but that's what they're billed at anyway. And so I've had the fights where I've had to go to the head of the ER of the department in my husband's company to say, please help us, and et cetera. We've done all kinds of numerous things. I love what you said about quoting the letters, the rejection, because they can't argue with themselves too easily. Once you quote it back to them and saying, okay, I fulfilled this promise, where's this? But I'm having trouble, and I would like to know if DebRA can back me up, if that's possible, on saying, okay, this is the reason she needs this. Is that at all
like
possible?
I said, we would certainly
with the
write a
insurance
letter for you,
companies?
but I think the first step in this, when it comes, and I'm not dodging the help, because we'll definitely will, but it's really to call Michelle at National Rehab, because they have a contract with United Healthcare,
They won't work with her.
What do you mean they won't work with her?
We've already gone that route. They refuse to do anything. United Healthcare refused to do anything with National Rehab.
But they have a contract with them.
I've been down this road
I don't know if
before.
anyone from National Rehab here. I heard.
Yeah. Okay.
Yeah.
Well, then we
Is
try a different one. We try CCS Medical.
Yeah.
Or we try Edge Park.
Is there an option also? I mean, I'm just throwing out options. Is there an option to go on the exchange and see if there's another provider that will cover the bandages? I mean,
The exchange?
Yeah, the health exchanges.
The health exchanges now. Yeah, you can give up your employer. I mean, I'm not saying to do it. I'm throwing out options, but you don't have to take your if United Healthcare is not paying for bandages, it may not be an idea to at least look and compare on the exchange and see kind of what your state offers and if they're going to have more success paying for bandages. I mean, I think that may be an option now because you can't be denied insurance
Based on pre-existing
based
condition.
on a pre-existing.
Yeah, and I don't want to talk for Bill Corman, but you should check with him. As I understand, they may be reworking a contract directly with United Healthcare starting October 1st.
My actual company hopefully will be changing from United Healthcare because they've had so many problems with them themselves.
Right.
They are an ERISA company, and I've been able to go more through the company than I have been successful in dealing with the United Healthcare themselves.
Yeah,
because
we
they
feel
were a
your pain,
disaster.
and I know how frustrated you must be. It's kind of if there's if you have a dead end in one, I mean there are options. Does your child have Medicaid in your state?
I'm the one with the junctional. And I don't
Hi.
have Medicaid or.
Sorry.
Bandages or whatever, do they cover with LNI? Like, will LNI Care cover? Because Medicare wouldn't cover my bandages at all.
You'd have to, I mean, Dan, you'd have to call like a National Rehab or a CCS Medical for that answer. If you're asking, will they cover, that's a question for them.
Okay. Thank you.
Like I said, but to your point, DebRA will help you craft, or I'll help, or will help you craft an argument. I mean, that's where I think we could probably provide some decent help. And there are others, by the way, it's not just us three. There are others that have been incredibly successful in crafting this argument, in crafting arguments. I mean, we know that it's amazing some of the things that have been paid for by Medicaids and Medicares. The fact is, you don't know until you push so hard that your fingers are bleeding. You never take no for an answer. You may not win every fight, but we'll help you craft it.
You win some fights.
Yeah.
A general advocacy approach I found successful just on a lot of levels is in crafting these arguments is you want to be for a person and not against a thing. So in your letters, you could say, this is the stupidest policy on page 151 and you need to point that out, I think, but the humanization of being for Jonah or Ella, Raffaele, and focus on that, I find it just be much more effective without compromising. You have to make your case with facts and arguments, but I just want to make that point.
Along that note, I wanted to mention, I don't know, I wasn't here for the whole thing, but don't dismiss the power of YouTube. Jamie Gibson Hartley at the last conference did a YouTube video for me because Medicaid in my state would only pay for 36 bandages a month and 12 foams a month. And after Bill tried to help me, she did a YouTube video putting our governor case, our governor's name and number, our Medicaid number, and within a week or two, I got a call from the head person in Medicaid and said, "You should never have done this. Should have never happened. Full coverage now, full
Great job.
coverage."
Perfect.
So that's an idea.
It is, but remember, that was, you had the facts behind you of why they denied, and you then did exactly what Joe said. You personalized the whole thing. So I wouldn't say that going to YouTube as a first way would be effective, right? But it does put political pressure.
I think another thing also not to discount also is call your state representative. I mean, call your state senator, and they can at least put you in touch with someone on the Health and Human Services Committee who can maybe help you navigate through the system. I mean, sometimes it is extremely frustrating. You hit a dead end and saying, this person just isn't working with me. This doesn't care. They're pushing paper. I mean, you have to be a little creative. There's not one way to do things. And you have to think outside the box, because you're really, at the end of the day, all you're caring about is that they're going to pay for the bandages. That's the end goal. And it is a frustrating process. I mean, I've gone through it. I'll continue to go through it, but you have to look at more than one avenue.
And write the date down that you called, write
First
the
and last
person,
name.
the time, because those questions, if it goes to 4 months later, they will ask you.
And I want to say, I'm sitting up here. I want folks to believe that we haven't taken some battles and bruises. I mean, we lost a couple ridiculous battles just last year. We were trying to get skilled nursing visits, and we live in Washington D.C., a major metropolitan area, and we just got tired, and it was like, it's hard. It's hard. We can relate with it.
Vanessa?
Sorry. So what we're finding is that my kids are all adopted. They have Medicaid, they have private insurance, but there's still things that aren't covered and aren't happening for them. And so there's waivers in every state that add to what you can get covered where Medicaid gets, where Medicaid ends. These waivers are supposed to pick up. I'm just wondering if anybody's had any experience in amending the waivers in their state to add EB, or if anybody's had any luck.
Compassionate allowance. We got EB added to the compassionate allowance for SSI and SSDI. So it's a fast track where if you just have the diagnosis, you can cut off about 3 months. So yeah, we've been able to do that kind of stuff. But because they are, as you said, so local, we would have to fight each one. It's a battle worth fighting, don't get me wrong.
Well, we're getting ready to, and we're going to, but I'm just wondering if anybody's had experience.
Yeah, I'm in process of working on that now. I mean, I have a lobbyist who's a friend of mine, and we're trying to basically attach that they cover bandages to a bill. Because if you put up a bill by itself, it's going to be tough. They don't want to spend money. But if it's another bill that's more important to some of the politicians and bureaucrats, and they can, fund, EB kids, it's more likely to happen. But it's tough. I mean, it's that's why the awareness is so important. You need some champions, and it sounds like that you might have a few. And I think the first suggestion would be to go in front of the state, Health and Human Services Committee, and just tell about your experience and basically say you have 4 kids. I'm sure that there's others in Utah that you may or may not know about. I mean, the more people that you can share the experiences, the better. And I think there's other states that these battles have been won. I mean, I know Connecticut. I know a bunch of others where the laws changed, and hopefully you'll be successful in anything we can do to help.
Also, make use of the social worker at the local hospital, the local politician. I mean, these are all calls that you can make. Whether or not it works out is another thing. But these are all areas to go to. Social workers will have a tendency to be able to know how to do that. They may even know pro bono lawyers to do it as well. I should say it's now, I don't know, little after 6, so we've definitely gone over our time. I know I'm more than happy to stay up. I'm sure these guys are too, to sit here and just keep answering questions. What are you saying no for? So you can go. You don't have to stay.
More questions?
You know, and you know, I think when does dinner start being served? Now, so we know. I'm sorry, what? Oh, really? Okay. So I'll tell you. Sorry. So why don't I do some closing remarks and then we'll go.
Chastity, Dave, any other questions?
Yeah. So that's why you're staying in the room so long. Haven't we told you about advocating for yourself? The whole point of this here, and interrupt us. You know, I think it was, you know, from my perspective, you know, as a father of Rafi, an EB kid, I actually learned a lot today. We had talks that were cardio, you know, heart issues. It was the first time that's ever been talked about. You know, we had some great speakers these past few days here. I mean, it was really a tremendous lineup. So for that, Kelsey and Jerry, I want to say thank you for putting those together so well. Please raise your hands. Kelsey's in the back. Jerry's up front. Did a really, really good job on that. All right, and the other thing is Jenny Kraft here from Gaylord? Is she right outside by any chance? What I'd like to really be able to say is the staff at Gaylord has really gone above and beyond to make us feel welcome. Where's Jenny? Jenny Kraft. So Jenny's been working with me and Karen and Kelsey and everybody and putting together this conference and making sure that everything not only runs smoothly, but much better than smoothly. So I think they've done an incredible job, and I just want everyone to say thank you to Jenny. No. I also happen to think the food was delicious, too. Yeah, I know. You know, the other thing I want to talk about real quickly, and I promise, you know I'm verbose, but I'm going to try to hold it quick. We are going to reach out to you guys and ask questions, you know, about, you know, what you liked, what you didn't like. We were going to talk to not only participants, but the speakers and the sponsors and you guys, because we have 2 years to start planning the next one. You know, and, you know, so far, I mean, I think these guys did a great job in planning this one. We want to be able to do it better next time. I mean, this is your conference. And I said at the last one that I would never call this a patient care conference again. Unfortunately, I was unable to come up with a better name. You know, and I'm good with a turn of phrase, generally. And I'm going to try to come up with them because, you know, as I said last time, we're not patients here. You know, we're just not, you know, and we're more than survivors, and, you know, we're more than inspirational. We're people that live day to day. That's what we are, and we do it better than most, right? So I don't like being called a patient here, you know. So, you know, again, last time I asked people to help us out. If you got a name, don't make it this long, you know. Epidermolysis bullosa, Friends Network, you know, that kind of stuff. You know, not really. It's got to be a little catchy. But I do want to rename it for next time. It is, again, at a Gaylord, you know. It's in Dallas, Texas. We got some Dallas fans out here.
Everything's bigger in Texas.
No, Gaylord's actually not bigger than this place, so we might be able to navigate a little better. But what I really want to do is say thank you, everyone, for coming out. I really do appreciate it. This was, as I said before, the largest gathering of EB people ever. So again, thank you to our sponsors this would not have happened without them. Thank you to our speakers for coming here and taking time away from, their busy schedules. Thank you to my board members who came. Thank you to our other EB families. And I'm looking forward to seeing everybody in 2 years. Now, please go eat.